All right, so for next up, we'll be talking about the components of pregnancy labor. Yeah, I had to put pregnancy labor because there are so many things called labor in the world. So if you just say components of labor, some people might be mistaking it, right? So I have to put pregnancy labor so that people are certain that this is actually an obstetric stuff. So components of pregnancy labor, you're just trying to talk about all these components. You won't really call them stages. These are all the different movements that the baby will showcase as they are trying to come out through the birth canal. Okay, so pregnancy labor is complex, beautifully orchestrated process. It involves several components and they work together to bring about childbirth. Okay, so the major components is, first of all, Alright, so first of all, you know that they are having uterine contractions. So those ones are rhythmic tightenings and relaxation of the uterus. They call them rhythmic because they are coming and going, So they are responsible for cervical dilations and they are responsible for pushing the baby downward. Okay. So cervical effacement and dilation. This one is when the cervix start becoming thinner. Alright, the cervix starts becoming thinner and thinner and thinner. So for up next, what we have is fetal descent and position. So the baby is moving down through the pelvis. Optimal position is vertex. That's the head should present first. Okay. So next you have rupture of membranes. Okay, commonly known as the water is breaking. Okay. Then maternal response. So the mother is pained, the mother is tired, she has an increased heart rate, she's excited, she has fear. You understand? Some women are even angry. Okay. So monitoring and assessment. So you always check for vital signs for the mother and baby. Okay, cervical checks, use of tools like the patograph to track the progress. So after all the drama and everything and the baby is out, you have to ensure that the placenta is also delivered. Okay, so this is it for the different components of labor, all right, and how they integrate to come about bringing the fetus outside.